That's the sound of the coffee pouring. Welcome to the Doctor's Brew. I'm your host, Dr. Abdulaziz Al Khayat, and having coffee with us today is Dr. Ahmad Albasiri. Welcome, welcome.
Thank you so much for having me.
We're super happy to have you here. Today, we're going to talk about something that has recently been truly revolutionized. And I'm not saying that that's not an understatement. It's been revolutionized in Kuwait.
Yeah.
What is the cornerstone of any population's healthcare system? And I'm sorry to the orthopedic surgeons out there. It's not the hospitals. It's actually in the polyclinics. It's primary care. In recent years, Kuwait has greatly changed its approach to primary care with great strides like getting the Family Medicine Board. It's the exam.
It's the exam, exactly.
Yeah, that's being accredited by the UK, and more to come, which we're going to talk about in the podcast. And so we're going to delve deep about primary care in Kuwait, where we were, where we are today, and where I think we're going to go in the future. We're going to talk about some controversial stuff as well. So it's not going to be, this is not just a promotion episode. We really want to break this down.
Yes.
And I think it's really important to do that. And who better than an R3 in the Kuwaiti Family Medicine Board. So thank you so much for coming on, Dictor.
Thank you so much for having me. It's an absolute pleasure to be on the show. I think I've spoken to you before this podcast, and I've gushed all over it. So it's an absolute pleasure.
It's nice to have a fan on, so that's high praise. Thank you so much. Now, I want to talk about some shout-outs real quick, and then let's talk about the coffee. So, shout-out-wise, as you guys know, if you follow our social media at thedoctorsbrew.kw, you'll know that we've been partnered up with Dream Med Scrubs. They're actually a scrub brand that is based in the UAE. Now, I love their scrubs. I've been wearing them recently on the ward. I do apologize because I wore them the other day, and that's why I didn't have them fresh for today's recording. But I've been wearing them recently on the ward. They're super comfortable. They have lots of different styles. And I want to emphasize this. I like that they are local. It's great. Seeing all these kind of, Figs, Skechers, etc. They're great scrubs. I wear them. But also I do believe that we should support our local initiatives. So adding something local to your collection is definitely important. And because we're partnered with them, we like to offer the Doctor's Brew listeners a discount. So we'll flash the discount code magically through the power of editing right over here. And please be sure to check out their online store. Follow our socials again, because you're going to see we're going to have some reels with them. We're going to post some stuff with them. So we're doing some cool stuff with them. And please, I really recommend to check them out. They're super cool. So, shout out number 1. Shout out number 2, Studio Stretch. If any of you are doing, let's say, a rotation in Shweikh, if, like, for example, Sabah Hospital, and, maternity, any of the Sabah Hospital hospitals, be sure to check out Studio Stretch. The other day I went in, they invited me to come in for a stretch, and basically you go in and they have a team of people of different backgrounds. They're physiotherapists, yogis, like for yoga, and they stretch you out. Now for me, that was super important because as many of you know, I recently just finished my exam. And I was sitting for 6 to 10 hours a day. And my muscles have just tensed up from the lack of movement for the past month or so. So going in the other day was really great. We'll flash their social media handles over here. And please be sure to check them out. And it literally takes 30 minutes. So just go in, get stretched out, and keep going through your day. We're all active. No need to hurt ourselves,
That's true.
So those are our 2 shout-outs for today. And let's talk about something important, the coffee. What do you think, Victor?
Yes. I absolutely love this coffee. I expected it to be a bit acidic, but it's not.
Okay.
It's very easy, like, on the palate. Maybe there's a hint of like a citrus undertone to it. I'm not sure if that's
yours.
Actually,
Yours, yes.
Yeah,
Good,
there's
good.
a bit of an undertone there. So I actually love it. It's so nice. Yeah.
Well, just to let you guys know, we're drinking we always drink this here on the podcast, Earth Roastery, and like I mentioned before, we're doing their drip, like kind of to go coffee pouches. I don't know the official name, but for if anyone wants good quality coffee, real quick, definitely recommend going there. So I'm glad that you like the coffee.
Yeah, it's lovely.
I needed it. I slept 4 hours last night, so
No
this
way.
is good. Yeah.
That's yeah. We should you should get your coffee for sure. I definitely need it. Honestly, today, I knew that coming to the podcast was like a huge step for me as well. Because I'm a huge fan of it. So it's nice to have coffee like over it. So yeah, that's nice.
I'm glad.
Actually, can I ask you a question before we go into it? Just to flip the table. Out of all the types of coffee, what would your friends like describe you as?
What would my friends describe me if I was a coffee?
Yes, that's the question. Maybe that's like a better way to frame it.
It's funny. I think they would describe me as a coffee I don't drink.
Oh, okay. Which is?
Espresso.
Espresso. No,
Yeah.
Okay.
Yeah.
Which is a bit
intense and delivers a punch.
Yeah.
I think if anything, I'm an espresso shot.
Nice.
Yeah.
Nice.
I hope nice.
It's good to be intense because it shows passion, and like doing medicine like as a job, you have to have passion for it. So yeah, definitely.
I'm glad you say that because that reassures me a little bit. I think I at times I do wish I was a bit calmer. Yeah.
I get it.
But you give me a very calm energy.
Yeah, that's the family medicine training.
Really?
Yeah, that's the family medicine training. You have to be calm. Yeah.
That's
you have
actually
to be
interesting.
calm. Yeah.
Well, I mean, each specialty requires its own, have you seen Dr. I'm going to butcher his name, so I apologize.
Yeah,
Dr. Glaucoma Flecken?
Yes.
You've seen the parody
the one
videos
who
or
does
whatever.
like the like a parody of like each subspecialty. Yeah.
So I'm sure you have to have the
Yeah, for sure.
Have you seen the videos on family medicine?
I've seen the videos on family. I've seen also the videos, I think, of the orthopedics.
But the orthopedics ones are 100% accurate.
It's so accurate.
Dr. Bassam Al-Mulla, who was on this podcast, if you're watching this, 100% you. Without a doubt.
I think like there's merit to every stereotype kind of. Like there are some bases to it, but like of course not everyone is like that. So yeah.
Well, I promise you this right now and to our viewers. If I am successful in becoming a psychiatrist, I'm gonna definitely get a tweed jacket.
That's
a tweed blazer. I'm gonna go in a tweed
blazer. That's amazing.
I promise that.
I'm looking forward to seeing that actually.
No, for sure. Okay, so let's. We've talked our shout outs. We've talked coffee. So we're caffeinated.
Yes.
We know that we're gonna go get some scrubs, and we're gonna go get stretched out.
For sure.
Cool.
Yeah.
Let's dive in here. Family medicine in Kuwait. I want to talk about the past and present. I'm going to tell you about kind of my experience with family medicine, like growing up as a kid.
Sure.
Because it framed for me what I thought was a doctor, okay? And this kind of illustrates kind of the differences in how things have changed. My impression, I don't know if this is true or not, but this was what I was told growing up, was that family medicine, going to themselves,
yes,
the doctors working in themselves, are doctors who decided not to specialize, and that's where they work. That's the role that's the primary care physician is someone who's not specialized, so therefore he delivers primary care. Was this the case before?
Well, I think there is merit to what sometimes that is said or that is thought of family medicine. Family medicine has come a long way from the start. So I think the first polyclinic that was established in Kuwait was in 1938.
1938.
Yeah.
So, really? Wow.
Yeah. That was the first one. So that was the first governmental one.
Okay.
That was established. The first hospital / polyclinic was in 1904. So just a bit of history there.
Okay.
So from then it was like the way we used to do family medicine was more of a general practice where it's the doctor telling the patient what to do, and then that's it. That's the bottom line.
So as in like the patient would come in, say I have a cough, this, and doctor's like, here's your medicine, get
Take
out.
this. Exactly. That's how it used to be. It's
Okay.
more of a paternalistic way. I think if that's like the word for it. But we've moved away from that.
Yep.
Like with family medicine. Currently in family medicine, in like polyclinic, we do have general practitioners. So they're mostly like expats or like non-Kuwaitis that have come here, and they're working just as a general practitioner
So without a specialty.
without a specialty.
Okay.
So like that's their job.
So sorry to interrupt
It's
you,
okay.
but to underline, because we do have some UK viewers
Yes.
here, and me going to the UK, I want to know, when you mean general practitioner, because in the UK, general practitioners would be family medicine equivalent for the US.
Yeah.
So general practitioner, what do you mean? You mean general practitioner in Kuwait is defined as somebody who's working the polyclinics without a specialty?
Yes.
Okay.
So basically, everyone that graduate from like medical school
Yep.
would go into their like intern year.
Yep.
And then after that, they become an assistant,
Mm-hmm.
and they are qualified to work as a GP. So
Right.
so then you can work as a GP for the rest of your life.
Sure.
There are some changes recently to that, like to that title. I think we recently have a program that general practitioners, Kuwaitis and non-Kuwaitis, that can go into, that is equivalent to a diploma, so they can get promoted.
Okay.
So has just been recently like introduced over, I think, the past few years. So that's something completely new, and that is something that has changed. So for those who, for like the non-Kuwaitis who cannot apply for like residency programs, they can go into this program. We do have in the Kuwaiti Board of Family Medicine, we do have some seats as well
Right.
for like non-Kuwaitis.
Right.
So there is a movement now to be like more holistic in terms of your training, to like better yourself and improve yourself professionally, whether that's through this program, which is I think 3 years,
Okay.
or through the complete 5 years program, which is the Kuwaiti Board of Family Medicine. So just to get back to the point where like, is the GP or the general practitioner, they only work in the polyclinic and that's it? Yes. In the UK, it's interchangeable. So family medicine is kind of the same as general practitioner.
Yeah.
But in Kuwait, we do have a lot of doctors who are now family medicine, who are, that are board certified. So we've gone through the training of like 5 years, and then we've gone through the exam that is accredited by the RCGP, which is the Royal College of General Practitioners, and then after that you are board certified. So you have tools that you've learned, that you've gained throughout the 5 years of training,
Right.
and then now you can apply these tools and your knowledge and skill to treat patients in a very holistic way.
Which I think this is also in line with the rest of the developed world.
Yes.
In terms of how we practice primary care.
Exactly.
You know, primary care everywhere else in the world is considered a specialty on its own,
Yes.
not a lack of specialty.
Exactly.
Yeah.
It is a specialty like on its own. It's a perfect blend. Like, pardon the pun, maybe like a blend. It's a perfect blend of being knowledgeable in like a vast variety of specialties. We are the psychiatrists, we are the dermatologists, the pediatricians, we are the internists, we are the surgeons.
You guys
as
just
well.
got to take everything, don't you?
Yeah, I mean, like there's a phrase that says jack of all trade, master of none.
Yeah.
In family medicine, it's actually jack of all trade, master of quite a lot of things, actually. So we are required to delve into all of the specialties to gain the knowledge that is required to treat our patients in an effective way, and like in a comprehensive and compassionate way as well.
Well, for me, I want to come back to this whole thing of, in Kuwait we have still people who are not specialized working in the polyclinics.
Yes.
So is the ultimate aim in the current, how we practice family medicine in Kuwait, the changes, is the ultimate aim to phase out people working in polyclinics without specialties, or rather they work with family medicine practitioners?
I think the aim would be for those people, like to gain the tools that we are that we learn and that we obtain. Like through the Kuwaiti Board of Family Medicine. So,
but do you think you can achieve that without going through the board itself?
Just like I told you before, there's like this new program that is for the general practitioners, which is like I think 2 to 3 years, and it is optional, of course. But I think going into it, you are equipping yourself with the knowledge and the tools that will help you treat your patients in a much better way and like in a more comprehensive way.
But like in 40 years down the line, do you think maybe eventually it's not going to be even, we're not going to have people going through these programs because they're just going to be going through the board?
That's the hope. Honestly, and like to be honest with you, the Kuwaiti Board of Family Medicine, I think the amount of people that we've accepted this year for the academic year of 2023-2024, we've accepted, or the board have accepted, I'm not affiliated with the board in terms of staff, but they've accepted 110 people. Okay. 110. So I think that's the highest number of all the subspecialties in Kuwait. So there is this direction of equipping the doctors to be family physicians and to providing care, because I think now the direction is not only to focus on patients. We are, as family physicians, we want to focus on the society. I want to manage the society itself. I don't want to just manage one patient or one patient at a time. I want to target the society and spread awareness and health promotion. So
I really love that. My experience with family medicine in the UK, I remember the GP that I was with, the general practitioner, one of the partners at the practice, they gave us a whole talk and they showed us, they said, see here, this is how they collected data of the regions. Yeah. And they were talking about how they analyze disease trends, blah, blah, and this feeds back into, the NHS and how, so they can monitor areas and they can be able to filter out, they're studying their population. So what they were doing was really not just, they were not working just at the patient by patient who walks in the door, the population level.
Yes.
I thought that was cool.
Yes. And I think, for us, as family physicians, we're doing more than just seeing patients. So the GP or the regular general practitioner, he would see patients, finish, and go home. Yep. For family physicians, for us, we do clinical audits. We do quality improvement projects. Okay. We do open days in malls and schools and stuff like that.
That's amazing.
Yeah, and as residents, we've participated in open days for there was currently the Rosacea Awareness Day in Asad Al-Hamid, and there was a few residents there who did that. Some doctors did the Diabetes World Day a few months back. We did a no hand CPR campaign, which was done in the avenues, and that was in collaboration with the Kuwait Medical Association and the Kuwaiti board as well. So we are out there, and we are not. We're not merely in the office sitting down and just sipping on coffee and treating patients and maybe giving sick leaves and stuff like that. We are out there, and we're trying to change the perspective as well, and change the perception of health. And I think we want to move more towards towards preventive medicine rather than just there's an acute issue, fix it, and then see you later. No, we want to prevent people from actually developing conditions.
I think, you know, our issue, a big issue in Kuwait, and I think few people would disagree with me on this, health literacy in Kuwait is poor. The understanding of health and healthcare, I think, it's something we struggle with.
Yeah.
And we feel it in the wards. And I think that's so critical what you guys would do, you know, educating the public about certain things, like, honest to God, and please, this is my feedback. Please spread awareness about contrast and CTs.
Yeah. I remember, like, I think I remember, like, you were speaking about that, like, in a previous podcast. Yeah.
It's because it's people, you know, if it comes down to, if a patient has more of an understanding of what's about to happen in the hospital, rather than, because if you think about it, in the hospital, we have like 10, 15 minutes with the patient?
Yes.
How are we going to educate them about a whole thing that we've been studying for years? To some extent, I don't blame patients for not trusting us.
Yeah, I can see like your point of view. Like, I've worked in Mustashfa Mubarak for 2 years. I was an assistant there, as like I was in internal medicine. So for 2 years I was assistant there. Yeah.
Okay.
So
I've seen that struggle.
I've seen that side. Like, I've been on the other side, and I've seen patients where, like, I've faced, like the health, like the lack of knowledge, the struggles that the doctors might have explaining stuff to patients, and the limited time that you have, especially like if you're like on call or like post call, let's say, and you've been like all night, and there isn't really like a time to explain fully. Like what's happening, and I think that's a responsibility of the family physician. We are, after all, the first point of contact. Anyone can come to my clinic at any time, just free of charge. Like, if you're Kuwaiti, of course, free of charge at any time. No one would say no to you. If you want to come to me and speak to me about anything, you're free to come. So that's my job as a family physician. I have the responsibility to answer your questions, to address the concerns that you have.
Yeah, someone doesn't even need to be sick to talk to you.
Exactly. Yeah. And that's what I say to patients. Like, for example, if you're like under stress, you have the right to come and speak to me, because I'm currently in the process of learning how to deal with like mental health, mental health, stress.
I've noticed that's a change recently.
Yes.
Didn't they recently pass a law now that you can get basic, for less acute psychiatric conditions, you can be able to get some treatment in the polyclinics?
Actually, there is currently 48 primary mental health clinics.
Wow.
48.
Wow.
And that's mostly run by the graduates of the board and the residents of the board as well. So we're talking R4, like R5. They are also running these clinics.
Right.
So things are going in the right direction, albeit it's a bit slower than we want it to be.
But you're moving.
Yeah, exactly. And we're changing the mentality of or the taboo of like mental health and like mental illness.
That's so. I you know, of course I'm biased because I love psychiatry and I love psychology. That is so essential.
Yeah,
and
for sure.
You know, can I tell you one thing that I love about family medicine in Kuwait? Accessibility.
Yeah.
One thing in the UK that I struggled with and I loathed was struggling to get an appointment with a GP. Because it's not fair that if I have to have a cold, okay, I understand that cold is just sit at home, rest, you'll be fine. But you know what? People get scared.
Exactly.
I remember after COVID, I was feeling breathless, and I was like, why am I feeling breathless? Is there something I can do? In Kuwait, I was able to go same day, see a family medicine physician, gave me some inhalers. I felt much better. There wasn't the, okay, wait 2 weeks, and then when I show up, be in line. That's something that is so genuinely beautiful, and it's something I do appreciate about healthcare in Kuwait.
Like, I think the accessibility, like in terms of everyone can come in, like it's something that we're proud of, and it's something that, and that's like I think it gives people it empowers people. Like,
It does.
if you want to talk about something, if you're worried about something, you have the power to come to us, and then like we can speak to you. There are some doctors, like family physicians, who would prefer the appointment based, because there were like at some point we would see like 100 patients a day.
Yeah.
Especially like during like school time. So there are some drawbacks to it.
Of course.
But at its core, when you're talking about the accessibility, the idea that if I need to speak to someone, I can. That's so beautiful for me.
Yeah. No, it's especially what you mentioned about mental health.
Exactly.
Because nothing is a barrier more so than if someone is asking for mental health aid or help. They're seeking help, to hear 2 weeks, 3 weeks. I've spoken to people.
That's demoralizing.
I've seen it exactly.
Yeah.
They literally, I'm gonna go out and even like, this is gonna sound extreme, but I really do mean it. When you see for example, a patient who's having suicidal thoughts, maybe they're not actively suicidal, you know.
Yes.
But for them to be like, right, in 2 weeks, just put your mind in the patient. They might not have 2 weeks.
They need to be risk assessed every like few weeks.
Exactly.
Like every week, from like for example, and I think like that's the responsibility of us. Like even when patients come to us and they don't speak, sometimes you get busy in the clinic and you just want you want to finish the line and everything, but there are certain points where the patient might not say anything, but you would notice their body language, their like eye contacts. Sometimes you'd like some patient would come in and they would ask for like a sick leave, and then they'd say like I've been stressed out and everything. Or sometimes they don't even say that. They just want to to have a sick leave. But then if you just take a moment to ask, are you okay?
Yeah.
Is everything okay? Is everything okay? Like with your life?
Yeah.
I've seen a patient who said, I'm okay with a smile, and then 2 seconds later just completely bawled out. Just by asking, are you okay? And that's heartbreaking to me.
What a sentence, you know? Just, are you okay? And just the response you get from, are you okay?
Yeah. So I think it's important for us. So it's difficult because we need to do that for every patient. If I even get the hint that the patient is a bit stressed out or a bit like depressed, I need to go through my screening.
Yeah.
I need to know if this patient is okay, or if this person is okay. Like for us, the people that come in, they're not patients, they're people. And then there's like, okay, they might have some physical like ailments.
Yeah.
Maybe they have some stress, maybe like there's some mental issues as well. So we treat patients there from, like as a holistic point of view.
That's so to kind of synthesize what I've gathered from you about family medicine before in Kuwait versus now.
Yeah.
So what I understand is that in Kuwait the shift has become, number one, family medicine is now a specialty, not a lack thereof of specialty. So number one is it's a specialty. Number two, it is about public education, changing the minds of the public, you know. And number three, it is about developing primary care within Kuwait, not just as, you know, not just to handle low-level things, but to truly treat on a primary level.
Yes, and I can add one thing as well. We've shifted from a paternalistic point of view or way of treating patients to a patient-centered approach. So what does patient-centered mean? It basically means we are giving the power to the patients. We are in a relationship with the patients. We establish a rapport where the patient is involved in their treatment. So it's not me making the decision for the patients, it's them.
Right.
Actually, there's this beautiful quote by Carl Jung. We were speaking about him before.
Yes, we were.
I think he was saying, I think the line goes as, I am not what happened to me. I think it says, I am what I do, or it goes along that line.
Hold on.
Yeah.
We're gonna find out.
Yeah, we have to find that
Hold on,
code,
we're gonna
actually.
find out.
We
No,
have to find the
because
code.
listen, for anyone listening, Carl Jung is a huge inspiration for me.
He's a
So-
Swiss psychologist, and I think his way of thinking, he has developed like
Oh,
the way of thinking,
I am
Yeah.
not what happened to me. I am what I choose to become.
what I choose to become. That's the one.
I love it.
That's the one. So it's basically, it's not me giving the patient the medication, and I've asked the patient to take it. It's me explaining to the patient what the condition is, what are the risks of not taking the medications, what are the benefits of taking the medications, and then giving that power to them. You choose now if you want to take the medications or not.
Yeah.
So it's very empowering to the patient. You're involving them in the treatment, so they feel a sense of responsibility.
Right.
So that's why this massive shift, I think, from being a paternistic like point of view, like a father to the son, or like a father to a daughter, to a more of a
We're
let's sit
sharing the
together
decision.
and let's talk. So I think that's just so beautiful.
I love it.
That's the patient is involved in their treatment, and then give them
I really
a lot
love
of power.
it because, and especially, I love that you guys are bringing in mental health into this, because COVID the mental health rates are skyrocketing.
Yeah, skyrocketed.
I recently did my elective in psychiatry. The clinics are full. Mental health is a thing. It's an issue. It is mu'aib, to go and get treatment.
Yeah.
It happens to everyone. And I think the more we represent people and openly share our stories with mental health, our struggles, our issues, the better it's going to be.
Yeah. And I think, like us as doctors, we have a lot of stress that we go through, and I think we are on the front when it comes to being at risk of developing mental health issue. So anxiety, depression.
The evidence is all there.
Yeah,
we're
it's
at
all
high
there.
risk. We're not low risk. We're high risk.
And I think when we talk about it, when we acknowledge that we are facing it, and it's not taboo, and we go out there and we tell the world we go through that.
Yeah.
We are people just like you, and it's not, and it's okay, and it's okay to I think it's okay to say that I have anxiety and I'm seeking help.
Yeah.
The fact that you're seeking help, it just means, and it exemplifies the power that you have,
Yes.
and the willingness to get better that you have.
Can I? My thing that I've always told, for example, if I have a friend coming to me and asking me, should I go seek help, for example, I want to just see a therapist, for example. What I always tell them is, because some people would say, why don't you just go talk to your friends? Why don't you just go vent it out with your mom? The difference is, whenever Ryan Reynolds or a big celebrity goes for a movie, they don't just hit the gym alone.
Yeah.
They have a dietitian, they have a trainer, even masseuse, everything. Just professionals who know how to maximize in delivering what their goal is going to be.
Yeah.
The same applies to a therapist. A therapist is a professional on guiding conversations to be able to, treat mental health issues.
Exactly. And I think it's okay, to have that social network.
Yeah.
And that social support around you.
You need it, yeah.
Of course you need it, but your friends might not have the tools, or they might not be equipped to deal with whatever that is going with you.
Of course.
So seeking help and seeking a professional, I think it's something that everyone should do. Yeah. Because we're all going through stress. We all go through mental issues. Yeah.
We were talking about mental health in terms of our stressors before the podcast. You were mentioning about your stutter. Do you mind if you can talk about that?
Yeah, for sure. So I think my stutter, I think it came in from 4th grade. I had so many issues with bullying. I think maybe that brought it to the surface. Yeah. I think there is some genetic element to it, or some genetical component to it. I think my uncle has it, my aunt has it.
Oh, okay.
Yeah. there is some component to it, and I think the bullying maybe like kind of like brought it like to the surface.
Yeah,
But
yeah.
living through it, and it was stressful. Like as a I think I was 10 at the time,
Yeah.
and just trying not to blame myself for having it, and trying to survive school where you're expected to like participate,
And speak perfectly.
read, answer.
Yeah, yeah.
It was a bit stressful.
Of course.
And there will be times when like I'm asked to stand up and like read a sentence, and then you're just stuck at the first letter. What sucks actually is when people ask me like, what's your name? And for me, like, the letter A is the most difficult one.
Really?
Yeah.
Oh, okay.
Yeah,
That's interesting.
it's difficult. It's difficult.
Okay.
So sometimes I would say Dr. Ahmad, which is easier.
Yeah.
But I think you should embrace who you are.
Yeah.
In terms of the stutter. The stutter is not an obstacle.
Yeah.
It is part of who you are.
Yeah.
It is something that you can work on,
Right.
and that is something that I have worked on.
Right.
So I used to be very bad. So like I would get stuck in the first word. I would maybe like repeat it like a few times. Sometimes I would have like a jerking, like my leg would jerk.
Right.
Until I say that word.
Right.
So it was embarrassing, and it was it takes a toll on you as a 10-year-old. So
I can imagine.
yeah.
I can really imagine.
Yeah. So, but thankfully, like I had fantastic parents. They acknowledged the fact that I was going through some stress,
Yeah.
that it was affecting me, and thankfully, like we sought help, and I think like help worked. Like, to be honest, but it takes, and I think goes back to being a family physician with the patient. When I sought help, they gave me the tools, and it was down to me now to go back home and actually work. So just like Karlian said, I am what I choose to become.
Yeah.
I chose to become someone who didn't let their stutter stand in their way. I've gone into medical school. It got much better like in med school.
Really?
It got much better, and
okay.
I think it's like it happened because I was out there a lot and I was speaking with people.
Right.
And
you're thrown into the deep end, really.
Yes, basically.
Yeah, okay.
But thankfully, I was equipped with like some tools that can help me.
Yeah.
Like navigate through like any issues that I had. I still have it. I still have that. Like the stutter, and it's much better. But I've learned how to deal with it, and I've learned how to not make it affects me personally. Like it
Right.
doesn't demoralize me.
That's amazing.
Yeah, but I get why it's like it is demoralizing to people, because you want to be out there and speaking, and sometimes you want to say something, but you're afraid to say it because like you might like embarrass yourself. So yeah.
Well, I all I hope is that there's one person listening, and maybe they're a medical student, high schooler, anybody.
Yeah.
I hope somebody's listening to see that you had a stutter, you faced adversity because of the stutter, you went to med school, and now you're not only a doctor, you're a doctor in a role of you are engaging with the community.
Yeah.
You are communicating. You're on a podcast talking.
Yeah.
That's amazing. I applaud you for it.
Thank you so much.
And I hope somebody's watching to be as inspired as I am. You know.
Thank you so much. I appreciate it. Yeah. It takes a lot. I like to be honest with you, and it's like it's down to hard work. It's it is. I think like the Beatles said it, like it's a long and winding road, you know. Like it takes time to get to that point, but it's something that you can work on. If I could do it, you can do it for sure. Trust me. Like with the proper help, with like hard work and with the intention that you have, I'm like
you can do it.
Yeah, for sure.
I hope we were mentioning this this podcast. I really want it to be a platform for people to get inspired by people like yourself, to see that, you know, we come in all shapes and sizes, and we all have our struggles, we all have our differences.
Yeah.
That's really my goal with this podcast, and I'm happy to have people like you on to inspire us. know, for me, we were mentioning this again before the show. I think one of I don't want to call it an insecurity, because it wasn't insecurity as much as something that really did, you know, it always been in my mind. I'm half, my mom is Cuban American. And so I came from a multicultural home, and working in the hospitals in Kuwait, I became more less exposed to people that were also multicultural, in the sense of like having Western parent, like mixed.
Yeah.
We call ourselves lovingly half-bloods or mixed breeds.
That's fancy. That's fancy, yeah.
So that was something that always was a thing for me, because also like in speaking in Arabic, I speak Arabic just fine. I speak Arabic with my dad. But if I'm not gonna lie, أنا قد بدليات. You know?
We all do, by the way. Trust me, we all do. Yeah, we all do.
And that was a source of kind of worry for me. And I can relate to you when you want to say something and it doesn't come out, because what started happening to me is because so of course I grew up in Kuwait. I spoke Arabic my whole life here.
Yeah.
But then I go live abroad, and I'm abroad for 6 years. When I came back, there was moments genuinely where people would speak to me, and I would try to respond in Arabic. The words are in my head. They don't come out. Can I explain to you why? No.
Wow. Yeah.
I still don't know why. I would go, with my colleagues, I'd just go.
Yeah.
I'd be stuck.
Yeah.
And I know
sucks.
it's embarrassing.
It sucks. Yeah.
I really do relate to you on that. It's embarrassing. Not to be able to communicate.
Exactly. And I think maybe that's something that's a bit heartbreaking, to be honest with you. Like, in terms of, sometimes you have so much to say. Yeah. But you're not sure that you want to pay the price of being embarrassed.
Yes.
To say that.
Yes.
You know.
Yes. Yes. Oh, you said it so well. I've had that. Yeah. The amount of times, I cannot tell you the amount of times that this has held me back over the past few months.
Yeah.
Really.
Yeah, and I think at the end of the day, like, you want to actually just speak your truth. Like, I know it's something that's said like in the pop culture now, but it's something that I can really relate to. It's, if you have something to say, just say it. Yep. I know the price might be a bit difficult, but that moment it will be going. Yep. And then what will be stuck is what you said. I agree. The value that you brought like to the world. That will stay. But that moment of embarrassment, people will forget about it. Absolutely. No one will actually pay attention to it. Yep. Sometimes we have like this spotlight syndrome, where we think we are the center of attention. Actually, we're not. Yeah, people don't pay attention to you. Yeah. They have their own things going on. Like, I think that's kind of what also helped me to, just like put myself out there. And like, I think like my struggle, your struggle, I think we all have. I think like our life, it's not perfect. Yeah. We all have that something like in our life that we consider the big issue. So like for me, it's like my stutter. Yeah. So we are all equal in terms of we're going through this life and we're struggling through it. Yeah. That thing of throwing yourself out there, I think that really is truly the key. Yeah. I think that's the solution. That's what I've been doing. Yeah. I think my biggest thing is now. I just go for it. Yeah. Like, what, life happens. Yeah. And coffee helps. Coffee helps. So, now, on the same line of talking about stigma. Yes. Again, I warned you guys, we're going to get into kind of the controversial side of family medicine. Let's be honest. There is chatter, and there is this aura about family medicine. And when I asked fellow trainees of mine before we had this interview, I asked them, what would you want to ask about family medicine, in Kuwait? And they told me, well, I want to know everybody who wants to go into family medicine, my friends, it's essentially because they want to take the easy life. They don't want to, they just want to, let's call it, they want to do diet medicine, Okay. Do I agree with it? Absolutely not. Yeah. But this is a common talking point. Yeah. And I think that actually having that
being, you know, that being in the what is it, the zeitgeist, is that what the term is, that going around is would be hurtful to the good that you guys are doing.
Yeah.
So what do you think of that stigma?
To be honest, I think that statement has a lot of flaws in it.
Okay.
Because sometimes you would say, what do you mean, like, by the easy way out? What does easy mean?
Yeah.
So I think family medicine is just like any other specialty. It has its own challenges. So to say that it's easier, it's a bit vague. What do you mean by? So I get the point where, like, some people like would say, okay, like, you guys have one on call per week,
Right.
which is true. We have it like during the weekend, so it's either Friday or like Saturday. So yes, we have a better like lifestyle in terms of we get to sleep every day at our house. I get that point, but like that doesn't really.
Can we just say how bizarre it is that it's like you just get to sleep in your house every day,
Exactly.
and that makes it easy. Oh, you get to sleep in your bed. Oof.
But people don't get to see the work that you do during the week.
Yeah.
So you would work from 7 to 2, same, like close to 7 hours, with the same intensity. The way that you deal with the first patient has to be the same way you deal with the last patient.
Right.
You cannot drop the quality of how you see patients. So, for example, the first patient, hey, welcome, like, how are you doing today?
Yeah.
Like, with a smile and like with the energy, and you go through like Socrates, for example, like you do like the the ideas, concerns, and expectation, and you do screening for them. And like if they're like 35 and like a bit like overweight, okay, let's check your sugar.
Sure.
Okay, but that's all well and good. Can you do that by 10 o'clock? Can you do that with 10 minutes to go?
Right.
Are you willing to go that? And I think, and you cannot like drop, you cannot miss, because sometimes you have to be very alert, because when you're in family medicine, every patient that comes in, you have to assume the worst. You have to assume that there is something major going on, because you're the first and maybe the last point of contact.
True.
So someone like would come in, oh, doctor, I think I have a headache. If you're just gonna give it like Panadol and that's it, you're missing so many major conditions that causes headache, and you have to be alert. You cannot say that. You cannot do that just because there's 5 minutes to go now. Let me just finish my shift. No, you have to go through. I think it's like a pilot with like an airplane.
Yeah.
They have to do the checklist.
Yeah.
Make sure everything is is well.
Ticked off. Yeah.
Then you would like calmly say, okay, I think what you have is this. I suggest, always you suggest, you never force on patient what to do. You suggest to patients, and then you allow them to put their input now. So you have to be alert, because sometimes there will be patients who come in, doctor, like I have a headache, nothing else going on, I'm completely fine. You check their blood pressure is 20 over 110.
Right.
That's insane.
Yeah.
That's insane. That's a hypertensive emergency. They have to be shifted.
Yeah.
So when people say family medicine is easy, it's not. You have to be alert all the time. You have to be you have to individualize your approach to patients. So for example, when you're speaking maybe like with someone who can speak Arabic and then someone who cannot.
Yep.
You have to
dance around.
Change your approach. Maybe you're dealing with a child.
Yeah.
Your approach is completely different when it comes to an elderly.
Yeah.
When you're speaking like with I think maybe like with ladies and like issues of like gynae.
Yep.
It's completely different, and there has to be like some privacy. You have some like some chaperone. There's a lot of things that go into it. We cover a vast like areas of medicine, and on top of that, we have to be very holistic in your approach.
Yeah.
So they're not patients with this. They are people. And then you have to go into their physical like ailments, then maybe touch on like their like mental health,
right?
Like and so on. Like even in their social life as well.
Yeah.
Like you have to ask about that. So just to circle back to the point where family medicine is easy, family medicine is not easy. It comes with its own challenges.
Yep.
And like on top of that, you have to have communication skills.
Yeah.
If you're someone who doesn't have that, you're gonna struggle. Like I don't think people, they're born with it. You have to learn how to develop it. You have to develop it over time.
Absolutely.
So that's on you. There won't be anyone with you when you're like in the polyclinic.
Yeah.
Your treatments is what the patient would take as the truth, and then they would go home, and maybe they will not seek anyone else.
Yeah.
So are you comfortable with what you just did?
Yeah.
You have to be on top of your game. You have to go back home and read. So like, for example, every day, like I would go and read about the cases that I've seen today.
Yeah.
So that when the next patient comes, I'll do that 1% extra that's better maybe.
And you know, one thing that I think, if all these changes in family medicine, essentially the aim is going to be lightening the burden on the hospitals.
Exactly.
So I think with more time, it's going to be more and more less of the work-life balance.
Yeah.
I really do think so in the future.
Yeah. Look, I think like if you're someone who is very passionate about people, if you're passionate about improving their health, improving their general health,
Yep.
if you want to develop that relationship with patient, that long-term sustainable like relationship with patients, if you're someone who wants to improve themselves. Okay, so there's another quote by Carl Jung as well. So I think he says, when there is a meeting between two personalities, it's like two substances or two chemical substances come into contact.
Right.
If there is a reaction, then they are transformed.
Right.
So when you relate that like to family medicine, from my perspective, I learned so much from patients in terms of their like resilience, the way they deal with, like for people, for example, with chronic disease.
Yeah.
The way they deal with their condition, it is inspiring to me.
Absolutely.
And their outlook on life as well. It is something that when I leave the clinic, I've learned something that day. There was a reaction, and I was transformed, just like Carl Jung said, you know.
Yeah.
So it is something. So like, if you're passionate about people, if you're willing to be open-minded and learning from patients as well, and if you love communicating with people, I think family medicine is a perfect fit for you.
Do you think that the stigma of family medicine is easy? Let me just go for family medicine. Do you think this hurts the practice? Do you think this hurts the goals?
To be honest with you, I think that thought is getting quieter.
Really?
I'm not hearing it as much now.
That's amazing.
Yeah.
That's good.
And the proof of that, I think, is that there's a lot of doctors coming into family medicine, and they are getting into the board of family medicine. So there's 110 medical doctors have been accepted now.
Yeah.
There is this awareness in society about the importance of family medicine and like the role we play.
Yeah.
In terms of the preventive care.
Yeah.
I really love preventive care. It's something that's shifted me towards family medicine from being in internal medicine, because when I was there, I have the utmost respect for the internists, and I appreciate what they do, the amount of work that they go through, and it's like insane. But for me, it wasn't satisfying what I was doing, because I think Dr. Bassam also said that before, that it's mostly geriatric cases, and it's like a recurrent theme of like UTI, pneumonia, like strokes and stuff like that.
Yeah, it was after the fact rather than before the fact.
Yeah, so it's when people come to you and like they have a stroke and they already have like the residual weakness and their quality of life have dropped.
Yeah.
And now you're just basically stabilizing their
trying
condition.
To bring them from lower than baseline back to baseline rather than
the baseline.
Up.
Exactly.
Yeah.
So I wanted more than that. I wanted to be the reason why a person, even just one person, they didn't develop diabetes, hypertension, they didn't go into ischemic heart, they didn't go into, for example, like stroke,
Yeah.
and you've basically added 5 to 10 years,
Of their life. Yeah.
and not just 5 to 10 years, 5 to 10 years of quality life,
Yes.
of
Yes.
moving around, like having fun with their kids, or like their grandkids. Just to do that for one person,
Yeah.
I keep like reminding myself that every time I feel down.
Yeah.
And trust me, like you have days where like you feel a bit
of
like
course.
stressed out.
Yeah. Of course.
So just reminding yourself of the fact that you might be the reason why someone would live longer and like live happier,
Yeah.
and live healthier, not just longer, and like live healthier. That's
Don't make me start doubting my career choices of wanting to go into psychiatry.
well, I mean, like my goal is maybe to get one person to find medicine. That's the goal.
Hopefully, really, people listening, I hope that someone's listening and is on the fence, and you're tipping them towards.
Yeah. If there's something that like I would say about family medicine, it's that it is very fulfilling, and the fact that you have like these relationships like with patients, you would see the patient, then you would see maybe like their kid,
Yeah.
and like maybe their brother, and then you would establish like this rapport where
It's more intimate, definitely.
it's so intimate, and they would trust you.
Yeah.
They would trust you. Like they would look for you. Like, I want to go see that doctor.
Yeah,
I think what they say is very beneficial, and like I'm gonna stick like to my like management. So if you can be that person to one person or like to a family,
Yeah.
you would feel that fulfillment straight away.
Now, what do you think? Because this is, you're selling me on family medicine here. What do you see? What's the future? What's the future hold
Yes.
for family medicine in Kuwait?
I think the future.
And the board.
Yeah, I think the future is very like exciting with the fact that we're getting more doctors who are family, who are family physician, who are like board certified, meaning they are equipped with so many tools to deal with so many aspects of the patient's health, and not just patient's health, not just the patient's health, but also with the population. We want to target the society as well. So we're moving more towards that. We are integrating mental health in like our clinic, and it's more open. As I mentioned before, we have 48 centers that are run by like board certified doctors.
Wow.
We're also doing like home visits as well.
Oh, that's great.
Yeah, we're doing
Yeah,
home
yeah,
visits as well. So, and it's something that we've started doing, I think, a few years back, but it's something that's hopefully, and that's the future where it will be like more spread out, especially for patients who are like bedridden. So, and the services that we provide in terms of like nurses, physiotherapists, medication reconciliation. There's a lot of services I think that we're incorporating. We're not moving towards home visits like that's it, but just incorporating that and serving a wider like area of people.
Yep.
There's also like the integration maybe like of like telemedicine.
Okay.
Yeah, so that's something that's maybe not done like currently, but it's like hopefully it's something that I really want to see.
It's really, I'm a huge advocate for telemedicine because in the UK, because we had insurance afforded to us with the Betha, my primary care physician was via phone.
Yeah.
And they would you'd schedule, ring, they'd talk to you on video, and then you'd.
Yeah, it's all about like adding to the accessibility.
Absolutely.
Of family medicine.
Yes.
Because there are certain people who cannot come to you.
Yeah, no.
I mean, we've seen that with like COVID. So there are certain people who haven't followed up with us for 2 years, and they're like diabetic, and they haven't followed up with you.
Yeah.
And then they've developed complications because of that.
And if they're not with you, they're going to be in the hospital eventually.
Exactly. So I think telemedicine, maybe it's something that I wish and I hope it's something that we can incorporate in the future.
Right.
Yeah.
And you also mentioned with the board, upcoming week, you have a week or something with the UK
Yeah.
board?
So I think a group of the Royal College of General practitioners.
Mm-hmm.
They'll be coming on the week of the 18th till the 22nd of June. It is an accreditation visit.
Okay, awesome.
So basically, they will be like reviewing the board's curriculum, policies, guidelines, teaching. They will also they'll do some like routine visits
Mm-hmm.
to different polyclinic centers in Kuwait. They'll be interviewing trainers, staff, and like residents of all years, and that's just to get a feel of how we're doing as a residency program.
Yep.
And if we're living and if we're reaching the standards that are set by the RCGP, and if that's done, we're talking about being the first residency program in the Middle East who have gotten the accreditation, the training accreditation. So
That's amazing.
it's a huge week for us,
Yeah.
like as a board, and it would have huge implications in the future.
So something to be very excited about, and I think for anyone who's considering family medicine, especially in Kuwait, I think getting this accreditation is going to be huge because
Yeah.
you don't need to leave to have that accreditation. Now it's offered in Kuwait. It's
Yeah.
going to strengthen our practice. I'm hoping for nothing but the best. I'm sure nothing but the best is to
And
come.
it's ultimately to the benefit of the patients.
Yes,
we are
absolutely.
consistently like upping our standards
Yep.
for the service of the patients, for the service of improving health in Kuwait, and like hopefully like we want to reach the preventative medicine screening, like that area where we catch the conditions early.
Before they happen. Yeah.
We want to maybe we don't want patients to turn up to the hospital with conditions.
Right.
We don't want to miss important conditions because the doctor didn't bother asking
The right question.
So as family physician, we have a huge responsibility that every patient that comes in and that fits the criteria, make sure that you screen, and because that's where you do the benefits. If you can prevent something from from happening, you're lessening the burden on
the patient, on the healthcare system, and on society.
Exactly.
Well, I think that's a good capping point. Thank you so much. This has been extremely beneficial, and I think, again, like I said, I hope people watching get excited about family medicine and the future and all the changes that are happening. Really great. Thank you so much for being on.
Thank you so much for having me. It's I've always wanted to come here, and I told you before, like I'm a huge fan. So like being here,
high praise.
Thank you so much. And like I really hope that people have a better understanding of like family medicine and what family medicine is, and should they choose to come into family medicine, it is something that is highly fulfilling, and it is something that you can have a huge impact on someone's life, and that's more than I can ask for.
I'm certain if anyone's tuning into this episode, that's gonna happen.
Yeah.
So
and if anyone has if any students or medical doctors have any questions, just they can contact me through my the Instagram handle, and I can I'll answer all questions.
Send that over to me so maybe we can show it up on the video. We can show it on the screen. So if anybody has any questions, they can reach out.
Yeah.
So that's the last sip of coffee for the day. Final special thank you to our guest and actually the Family Medicine Board as a whole. Thank you
so much.
guys for coming on the Doctor's Brew.
I appreciate it.
So till next time, guys, be sure to follow and subscribe to our social media. And thanks again.
Thank you.
Hope you all enjoyed this episode of the Doctor's Brew. New episodes to listen to with a cup of coffee coming your way every Sunday on YouTube and Spotify. And be sure to follow us on Instagram for all the latest updates. See you next time.